Please welcome Unika Alexander from the Proficient Lab. Hi, Unika, how are you?
I'm good. How are you? Can you see me?
I
Yes, so
cannot see you, and I'm sure we'll fix that in a moment, or if we can just remove her background, perhaps that'll help a little bit. But otherwise, we'll go off camera and we'll just do an interview with no video. But if you could, again, just give everyone a little bit of background on yourself and your company.
so hi to everyone who's been here today. I think these talks have been amazing. My background is specifically in laboratory medicine. I've spent a lot of time in fertility medicine in terms of just my field of work. However, what I found is that we have quite a bit of gaps in terms of our quality from a fertility standpoint. And as I started looking more and more into our different, different aspects of laboratory medicine, we find that not just for laboratory, but also for point of care, that these problems are very much agnostic um, of testing. So it's not just in one specific area or another. So our company is an AI-enabled electronic quality management system. And what we do is that we bring collaboration, so universal collaboration. We bring interoperability with different platforms within the healthcare networks. And we also bring AI integration to help speed up some of the challenges that we have in our healthcare systems.
Super. And can you share your screen? I know you have a presentation you're sharing with us as well.
Oh yeah, I have a like 4 slide presentation.
Yeah, it's fantastic. And again, I think the cornerstone here to what we're seeing is that we have a lot of labs around the country, around the world that are being run by folks that have only been running research studies for maybe 3 6 months. They're research interns, they're postdocs, they're grad students, whatever it might be, and so they're new to the research world. And having your system in place really seems to be making a big difference in at least HITLAB's analyses of what you're putting together. And that is really what is exciting from our standpoint in terms of how digital is really vastly transforming and revolutionizing the research process. I mean, we don't see a ton of digital in that area, but yours is really one of those nice stories. So looks like the screen is up now. So if you could walk people through a little bit about what you guys are doing and how you're really changing the face of medicine and research in medicines with digital technology in the lab management system.
Yeah, absolutely. So I will say that for this presentation, I focused a little more on healthcare opposed to the research side of it, but a lot of this is transferable. There's absolutely nothing that is siloed to the healthcare space in terms of our system. And what I will say is that, actually, let's just go. So we're focused on, for this presentation, I'm focusing on AI and quality management and testing as it correlates with diagnosis and treatment. So right now in the US, we have 3 systems that we use in tandem when it comes to our healthcare spaces. We have LIMS, we have EHRs, and we have electronic quality management systems. And a lot of times when we look at the output that we want in terms of patient care, we're looking for safety, we're looking for efficiency, and we're looking to reduce costs. These are the 3 big pillars that we have in our healthcare systems. And we very much focus on LIMS and EHRs because those are very much front-facing. But quality management is something that is a non-negotiable. Not only is it a regulatory requirement, but if we don't infuse that with patient results from the foundation of what we're doing in our healthcare systems, then we could never achieve safety, efficiency, or the desired cost that we want. So at this point, what we are doing is using AI to simplify some of the complexities of quality management as it pertains to testing, diagnosis, and treatment. Like Stan mentioned before, we're not specific to healthcare, but for this conversation, we're going to focus on that. So part of what we're doing is looking into AI-enabled training, AI-enabled workforce optimization, AI-enabled audits and predictive analytics, as well as AI-enabled method validation. And all of these 4 areas that take up a substantial amount of time in terms of just human resources. And when we look at what's happening right now, we have from cradle to grave in America, we run over 14 billion tests annually. And we use that to inform over 70% of medical decisions. And this comes from the laboratory space and also from point of care. So this becomes a huge burden to manage and a huge burden to just get right. So what we've seen is that AI-enabled training, whether it's simulations, whether it's visualizations for workplace monitoring, in terms of monitoring what the correct action is and using AI to detect any discrepancies or deviations, that is one way that we could use AI for training, as well as content and resources. We know that in the healthcare space, as well as life science, this is one of the most heavily regulated spaces. So if we're able to provide content and resources at the point in time when it's needed to make those decisions, this is one way that we could really use AI to make training more robust. In terms of workforce optimization, this is another place that AI has huge advantages. So understanding the current pool of individuals that you have in your system and being able to really understand what the strengths are, what the weaknesses are, and being able to use AI to actually place your employee based on their skill assessments in a QMS. That is something that we see a huge opportunity for AI. Another one is audits and predictive analytics. So I know that multiple people today have talked about audits and predictive analytics, and at least predictive analytics, and it's no different in a laboratory or a testing space. Audits are done internally and both externally. These are regulatory requirements. They take up a substantial amount of time. And even with an electronic system, it still takes up more time. And that's where AI comes in. How can we use AI to actually make these happen faster? And yes, we have that layer of AI, but also things like interoperability, which our platform offers, also helps out with that quite a bit. So being able to trace information from your LIS to your EHR to your QMS in one comprehensive string of data is something that AI could really help do with the help of interoperability. And then once that's done, we're able to really identify gaps using AI and then suggest remediations. So the final thing I would touch on is AI-enabled method validation. And this is actually the first model that my company, the Proficient Lab, is focused on training. So we're replacing the manpower for subject matter experts and using AI to validate tests and instruments. And for anyone who's familiar with the healthcare space, we know that this takes months. We usually have a manufacturer who comes in, they perform precision, but there are all these other claims that need to, that these instruments or tests need to meet in order to actually be able to provide accurate results for the physicians who, at the end of the day, use these results to drive the medical decisions and provide treatment for patients. So it's extremely important that at that level that we use time-saving tools like AI to be able to validate these methods more appropriately. And by using AI, we're able to shave months off of this type of process and get things going quicker. And this also applies to life science spaces and research spaces. So it's no different. Being able to validate these methods in a more time efficient manner is something that AI brings to the table, and we're very excited to provide. So this is what I have for today. I'd love to kind of continue chatting with Stan, and yeah.
I think we can take some questions too. We've got a few more minutes. And so, from the audience, we certainly have a few questions. One person who's connected with me through LinkedIn is asking a question is, what's the implementation time for your system? And again, you've got, I know, numerous customers. So what's the standard implementation time that you guys use to implement?
So the implementation time, that's a loaded question because it really depends on what part of our system you're trying to implement first. So we have quite a few verticals in there. From a QMS standpoint, there's so much for anyone who understands how a QMS is used. There's so much that goes into it, from your employees to your documents to your data. So if you're coming to us and it's like, I need a space for document control, we could get that implemented in a matter of weeks. Also, if you're starting from scratch, it makes a difference. If you already have processes and procedures in a manual way that you're trying to digitize, then that implementation would be much quicker, opposed to having to build all of that information from scratch. So the short answer is that it really depends on what vertical, what use case you're trying to implement in our QMS, as well as where you're starting from in terms of what you already have. And I would be happy to be introduced to the individual who's asking, so I could kind of explain a little more to them.
No, of course. Another question coming in is around the durability and the ongoing maintenance. How much does a lab manager, when they're implementing this, have to put into maintaining it over the course of a month, kind of a year, a semester, a year kind of thing?
Because of my background in laboratory medicine, part of what makes us really unique is that we don't just look at the data in the platform. We really look at how people interact in the platform, and our system is very interactive, meaning that it's not just the lab manager who has to deal with maintenance, it's the employees have their tasks to do. And because we put in a lot of reporting in our system, the information comes to you in terms of what needs to be maintained through emails, through options to provide text to yourself, to just reporting that you're able to see on a dashboard or different search functions. So in terms of maintenance, it is minimal because the information is coming to you opposed to you having to search in there to figure out where things are or what's in a process and what's overdue. So I would say it's minimal.
That's brilliant. And in terms of the future, one last question. What does the future look like for you guys over the next 5 years?
So the future looks like the future lies with collaboration and interoperability. I think that is something that is severely lacking in quality management systems. It's handled in a silo. A lot of times the importance of it is missed. So being able to be interoperable with other systems in a healthcare space, whether it's the LIS, the EHR, using middleware for different point of care devices or different instruments. I think the future is interoperability and the future is collaboration. So having one platform where whether we're in Europe or whether we're in the US, we could collaborate on a specific data set. That is very important. So in terms of quality management, being able to see the full spectrum of quality management from start to finish when you look at a single result for a patient is the future. And having AI be able to give you more data on that full spectrum and predictive analytics on that full spectrum without isolating it to just a quality management system or just an LIS system is where we're heading in the future.
Tell the audience a little bit more about the number of implementations you have. Again, we've obviously tested your platform. It's bulletproof. It's just absolutely first class, commercial grade. Tell the audience about some of your just how many implementations, customers you have, users, which is a different metric you guys carry, and then how expansive you're growing and how quickly you're growing.
Yeah, we have, in terms of implementation, one of the biggest implementations that we've done so far is about 90 different sites across the US, spanning from the East Coast all the way to Hawaii. That type of implementation did take longer just because there were hundreds of individuals who needed to be onboarded. So that's kind of one of the more vast implementations that we've had in the oncology space. We've had some smaller implementations in the fertility space where we've been dealing with teams of 20, 30. So yeah, we've seen both spectrums of implementation. Did I answer that question?
No, that's fantastic. And I think that helps give the audience, especially the buyers and the people who are in the lab management space on the show, an idea of what it looks like and how it looks like and how it's rolling out, right? Because that's so important for folks these days. Everyone's operating at a reduced cost structure and reduced infrastructure support level. So the ability to not only implement simply, but also being able to implement efficiently is absolutely of the utmost importance, right?
Absolutely. And I think something that is missed a lot of time is the way data is visualized. And I like to use the phrase a mountaintop view because a lot of times we implement systems across different networks and it's very much siloed in terms of even if we're using the same system, it's a matter of logging out of this site to get into this site and logging out of this site. And you can't possibly visualize data in a holistic way by using a method like that. And we really do have a top of the mountain view where now you could see everything and you're able to piece that information out in every which way that you need to actually understand what's happening in your organization at a more granular level. So that's something that's very important to the design of what we're providing.
That's wonderful. Well, again, Unika, thank you so much for joining today and looking forward to hearing many more good things about your development and your overall growth in the ecosystem over the next few years.
Absolutely. It's wonderful. Actually, I think I just got a camera.
All right.
Wonderful. Thank you.